If you've recently been told that your PSA level is 8, 9, or even 10, don't let that single number steal your sleep. Many men hear that result and immediately assume the worst. I see that reaction often in my clinic. A patient sits down, shoulders tense, eyes searching my face before I've even opened the chart. Sometimes they've spent hours online reading frightening statistics. Sometimes they haven't slept the night before their appointment. And almost every time the first question is the same. Doctor, does this mean I have prostate cancer? If that's the question on your mind right now, take a moment and breathe. Because the truth is something many people are never told. A PSA between 8 and 10 does not automatically mean cancer. In fact, many men with PSA levels in this range do not have aggressive prostate cancer at all. I'm Dr. Nova Ellish, and today I want to walk you through the calm, step-by-step way doctors actually evaluate this result in real clinical practice. PSA stands for prostate-specific antigen, a protein produced by prostate cells. Both normal cells and abnormal cells make PSA, which means PSA is not strictly a cancer test. Instead, it's better understood as a signal of prostate activity. When the prostate becomes more active or irritated, PSA can rise. That activity can happen for many reasons that have nothing to do with cancer. For example, a very common condition called benign prostatic hyperplasia, or prostate enlargement, naturally raises PSA as men get older. Inflammation of the prostate, known as prostatitis, can also elevate PSA. A urinary infection, recent ejaculation, vigorous cycling, or even certain medical procedures can temporarily increase the number. This is why experienced doctors don't panic when they see a PSA between 8 and 10. Instead, we look at the full context around that number. The first thing we examine is PSA trend. One isolated PSA result doesn't tell us much, but several results over time can reveal a pattern. For example, imagine a patient whose PSA was 5.85 years ago, 6.9 3 years ago, 8.4 last year, and now 9.2. That gradual rise over many years often points toward benign enlargement, not an aggressive cancer. Compare that to someone whose PSA jumps from 3.5 to 9 within a single year. A rapid spike like that would deserve closer attention. Doctors call this rate of change PSA velocity, and it's one of the most useful clues when deciding what to do next. Age also matters when interpreting PSA numbers. As men get older, the prostate typically grows larger. A PSA of 9 in a 70-year-old man may be interpreted very differently than the same number in a 45-year-old. Prostate size itself also plays a big role. A larger prostate naturally produces more PSA because there is simply more tissue making the protein. That's why doctors sometimes calculate PSA density, which compares the PSA level to the actual size of the prostate. A PSA of 9 in a very large prostate may actually be less concerning than a PSA of 6 in a small gland. Another useful piece of information is free PSA percentage. PSA circulates in the bloodstream in different forms. When a higher percentage of PSA is circulating freely, the likelihood of cancer tends to be lower. When the percentage is lower, suspicion can increase. It's not a perfect test, but it provides another layer of insight. Doctors also perform a digital rectal exam, which allows us to feel the surface of the prostate. A gland that feels smooth and enlarged often suggests benign growth, while a firm nodule or irregular area may require further evaluation. In modern urology, one of the most helpful tools before considering biopsy is prostate MRI. MRI allows doctors to see detailed images of the prostate and identify areas that might look suspicious. If the MRI appears normal and the overall risk profile is reassuring, many men can choose careful monitoring instead of immediate biopsy. Monitoring doesn't mean ignoring the problem. It means regular PSA testing, follow-up exams, and sometimes repeat imaging to keep a close watch on any changes. If the MRI does reveal a suspicious lesion, then doctors can perform a targeted biopsy, focusing specifically on that area rather than randomly sampling the entire gland. A biopsy remains the only way to definitively diagnose prostate cancer, but it's not always the first step. Doctors weigh many factors before recommending it, including PSA trend, PSA density, MRI findings, physical exam results, family history, and overall health. The goal is always the same: identify clinically significant cancer while avoiding unnecessary procedures whenever possible. If you've recently received a PSA result between 8 and 10, the most important thing you can do is have an informed conversation with your doctor. Ask to see your PSA trend over time. Ask about PSA density or free PSA testing, and ask whether a prostate MRI might help clarify the situation before moving toward biopsy. These questions help guide a thoughtful, individualized decision. The most important message to remember is this: a PSA number on a lab report is not a verdict. It's simply a signal that deserves careful evaluation. Many men with PSA levels in this range either have benign conditions or very slow-growing cancers that can be safely monitored. Knowledge and context turn fear into clarity. I'm Dr. Nova Ellish, and my goal is to help you understand your health with calm, evidence-based guidance. Because in medicine, a number is not the end of the story. It's just the beginning of the conversation.